Greenberg from San Juan Regional Medical Center. Good morning. Thank you for your patience, and it's good to have you on the show this morning.
It's a pleasure to be here. Thanks for having me.
You bet. Thank you. First and foremost, can we talk about conditions at the hospital? Are you still being overloaded with patients, or how do things look today?
Well, currently at our hospital, as of this morning, we have 92 COVID-19 patients. So that includes COVID positive patients as well as persons under investigation. Our total census is 182. We have a handful more folks holding in the emergency department. But really the important message right now is we have so many people that are really, really sick in the hospital right now. Very high proportion of critically ill folks, a really remarkable number of folks that are on ventilators, largely due to COVID-19. And so we continue to be very taxed by the COVID-19 pandemic here locally. And so we're fortunate enough to have been supplemented with some staff from the United States Department of Health and Human Services. And we are working with our third disaster medical assistance team. This team is a combination of folks from Oregon and Oregon and Alaska. And we are actually looking forward to next week beginning a 30-day supplementation period with the United States Navy. So we continue to have challenges locally. We continue to do what we can to meet the needs of the community for COVID and non-COVID illness. But now is definitely a time to, never too late to get your vaccine. So get vaccinated, but now is also a time to wear masks, wash hands, appropriately socially distance, and really try to make those good decisions, because even though it may not feel it when you're out walking about, the hospital and your local healthcare infrastructure is really in the throes of the most severe COVID-19 surge since the pandemic began.
Well, scary stuff. So let's talk about staffing here. I believe that DMAT was deployed. So maybe you can explain what DMAT is and how that's going, and how are they integrating well? How's all that going?
I'd be happy to. And, so DMAT, so that's a disaster medical assistance team. These are civilian teams that basically are comprised of healthcare professionals from around the country. And different states have teams. I actually participate myself on New Mexico 1, so the New Mexico 1 DMAT. But these teams supplement after there's been a presidential declaration of a disaster, and after there's been a request by a state for these resources. And so there's a whole framework for how that happens. But usually these teams represent about 35 people with roughly 20 to 25 healthcare workers in that team, and they move in the setting of usually natural disasters, hurricanes, or earthquakes, tornadoes, etc. But in the context of the pandemic, the National Disaster Medical System, which is a portion of the United States Department of Health and Human Services, has actually done considerable repeated deployments just to supplement regionally high rates of COVID. And so they've been doing this for a couple of years now, and we've been very fortunate to host them. And they are, as I mentioned before, our third team. We've actually, they usually come out for about 2 weeks at a time. Our first team was Florida 3. Our second team was Ohio 5. And so these teams have integrated very well into our team here. And by and large, they get right to work, and they work very hard, and we can't express enough appreciation for the support received from these highly skilled professionals.
Good to hear. And Dr. Greenberg, we have seen some reporting, I think, in the Daily Times and maybe elsewhere about the reaction from some of these teams who've come to Farmington to work side by side with your colleagues at the hospital, saying how warmly they've been welcomed, what a welcoming community this is. And I just wanted to kind of remind the audiences about that and how they were able to integrate, I think, pretty well with the existing staff. And they weren't shy about telling folks about that.
Yeah, we really enjoyed a fantastic working relationship with these folks, and it continues. And I have to say that, getting this support from the federal government here is no small task. And so we also have a great working relationship with our local emergency preparedness folks, and we've received a lot of very good responses and tangible support from the New Mexico Department of Health. So we're very appreciative for the effort. I think that the facts on the ground here in Farmington look a little bit different than other places within New Mexico. Our greater than, say, 220% ICU rates, which have been sustained for weeks, really puts us in a different class. And we are fortunate to be able to work with some folks at the state and at the federal level who have recognized this and allocated some additional resources for us to meet the needs of our community.
So let's switch gears and talk Omicron here. There's been a deluge of information about this thing, and I just feel like if it would be helpful if you can clarify succinctly what is happening.
What we know. And by we, I mean you.
I do think that what we actually understand right now about Omicron is that it is a variant of concern, which means that there's been some changes, somewhere in the order of 30 potential mutations that make it different than the previous variants. And we've also noticed that it seems to be more infectious than some other variants, including Delta. But beyond that, right now, we are in an information gathering phase. People are concerned about it. I think that it's reasonable to have some degree of concern, but I would encourage everyone not to panic. Everyone has these questions about, can I get more sick with it? We don't actually know the answer to that question. Will my vaccinations protect me against Omicron? All the information thus far looks like the answer is probably yes. But it also looks like those folks that have been vaccinated also have contracted Omicron. And we don't know really about the severity of the illness that's associated with this variant either. So what we're in right now is this uncomfortable phase where we have this idea and we're concerned about something, concerned about this viral variant, but we don't have the facts or the science to really inform how we should respond. And so what we're seeing is the United States government and other governments around the world taking precautionary steps in order to slow the spread. And really, I think everyone, including the United States, acknowledges that this is going to be a problem for us here. But the real goal, I think, for some of these travel-related restrictions is to create a little bit of time so we can best understand what is happening with Omicron and how we could best respond. I know that Moderna and the Pfizer-BioNTech team are working on, does Omicron require a specific booster? And there's studies ongoing about what the impact for some of those new oral antiviral medications that are really yet to hit market, if they impact Omicron as well. So I would implore everyone to do the most sensible things. Well, let's remember before we had vaccines, what did we need to do? We needed to socially distance, wear masks, wash our hands, and stay home when you're sick. And I would say that in our current situation, our wave locally, it's a Delta wave. And those precautions really should continue to be the area of focus, even as you look into the unknown with Omicron. And of course, get vaccinated. The vaccine really does indicate it will absolutely, I shouldn't say absolutely, it will likely confer immunity associated with the Omicron variant as well. We just don't know how well the coverage will be translated. But get vaccinated. And if you've been vaccinated, get your booster. And we will go through, the Omicron variant together. And as we develop a better understanding of the science, we'll be sure to communicate that as well.
Thank you, Dr. Greenberg. That's a great explanation of where we kind of are in this period. And I think we keep hearing, from other national health figures and things like that, it seems like Omicron is certainly in certain states confirmed. But even if it's not confirmed, it's going to spread through this country like it is spread in South Africa and that continent. And I imagine that there may be a case already in New Mexico that we're just not aware of. Is that a good thing to think about and follow the precautions that you outlined?
Well, it does look like day by day more cases are being discovered around the country. But we also do have Delta, which is another highly transmissible variant. And so you have to think really that Omicron is going to have to outcompete Delta to become the predominant strain. But absolutely, Scott, it's really important for folks to take these basic precautions, take them to heart, not because of Omicron, but because of Delta, and because it's the right thing to do to keep themselves, their family, and their loved ones healthy.
So I have a question about mutations. Does each strand contain a certain number of possible mutations? Will mutations ever end? What do we know about that?
Well, each of the variants has a specific, when you get a good understanding of either a variant of interest or a variant of concern, they characterize the nature of the mutations. And the mutations really represent changes to the genetic structure of the virus that then translates to a different series of proteins, which means a different shape of the spike protein. The spike protein in particular is what we're concerned mostly about, because the spike protein is like the key that helps the virus get into the cells in the human body. And so, we also have, by and large, our approach with vaccines is also about the spike protein. So we develop antibodies and cellular immunity to the shape and the molecular structure of these proteins. So we get concerned about mutation because sometimes the shape could change, and therefore we're not quite sure if the antibody response or the cellular immunity response is going to be as effective or robust. So do mutations occur? Absolutely, they occur all the time. So we expect these variants to occur. We expect them to occur continuously. The real question is, like we were just chatting about, are these variants going to have changes that are meaningful? Is it going to be more infectious? Is it going to represent a more severe disease? Is it going to have what we call vaccine escape, which is it going to evade the immune response which is created by vaccination? So that's why there's a sort of a defined and structured approach to first the recognition and then the evaluation and characterization of each of these variants. And I think that the WHO and organizations around the world are getting better at this. But this is a posture that we're likely to have to take for quite some time.
Thank you, Dr. Greenberg. And I just want to follow up on that because this is the normal progression, I guess, of viruses, is it not? This is why the flu virus, for example, changes from year to year, and there's a new type of flu that the vaccine is then, the flu vaccine, the flu shot is created to help fight, and things along that line. And there have been many other COVID variants that have come up, but only these ones that we kind of hear about that raise to the level of a concern by these health officials are the ones that we hear a lot about in the media. Is that true as well?
That's absolutely true. I mean, influenza has a couple different kinds of changes that happen. Some of them are gradual, some of them are sudden. Those are what we call antigenic drift and antigenic shift. Coronaviruses also have just a continuous mutation. And the real important thing about coronaviruses and the development of variants is that's why it's so important for everyone to get vaccinated. The more folks have this illness, the more people have COVID or coronavirus, reproducing in any particular host, the more likely it is for happenstance and for these mutations to occur over time. But then these variants do have to create an illness which is highly infectious, and then they also have to create one which is going to outcompete other variants. But really we're talking about, billions of people around the planet and an interconnected world. And so that's why vaccination efforts around the world have to continue, and vaccination efforts in each and every community need to continue to try to minimize the likelihood of variant development. And that's why we have to stay on top of it when it comes to surveillance as well, to make sure that we can respond and make sure that our healthcare infrastructure is robust enough to tolerate any potential surges from new variants.
So if we were to have more people vaccinated, would we therein have less variants? That's absolutely the theory. The theory is that if we have less people that will that basically represent a host for unfettered reproduction of the coronavirus, the less likelihood there would be for the development of variants that would have some kind of genetic reassortment that could result in vaccine escape. But that is sort of in our current world. This isn't just in any community. This is around the world, and so that's one of the arguments for really a robust, long-lasting, and effective vaccination campaign that would reach as many people as possible around the globe, and there we would all benefit from the reduced likelihood of variants. Very good. Well, Dr. Greenberg, as always, it's a pleasure to have you on. Thank you so much for taking some time to share your expertise.
My pleasure. Thanks so much for having me on. You guys stay safe out there and be well.
You too. Thank you very much, Dr. Brad Greenberg, Center Regional Medical Center.